This lecture covers the digestive system infections. So the digestive system includes the GI tract as well as any of the accessory type organs. So with the GI tract, it's from mouth to anus, and it includes the upper GI tract as well as the lower GI tract. So with your upper GI tract, you've got the mouth, pharynx, esophagus, stomach, and then the lower GI tract will include the small and large intestines, rectum, and anus. Accessory organs include salivary glands, liver, gallbladder, pancreas. So the GI tract is associated with lymphatic tissue, so the tonsils, appendix, Peyer's patch, and it serves as a major entry portal for many pathogens. So there are a number of barriers that can limit what microbes can colonize within the GI tract. So this would include things like lysosomes in the saliva, the acidity of different of your gastric juices, the bowel salts, which can kill bacteria, the mucosal lining, which acts as a barrier to prevent the microbes from actually attaching. And then you also have your immune cells and lymphatic tissue that help aid in combating any sort of infection. The digestive tract is home to the most diverse and dense population of microbes in the body. So microbes will actually reside on mucosal membranes throughout the digestive tract and throughout different locations along the GI tract. You have different genera of organisms. And so the most common residents include the Streptococcus species that can be found in the mouth. The teeth can be colonized by various organisms. Feces has bacteroides, and then some of your fungi and protozoa will actually live in the digestive tract, although the bacterial population can outnumber them. They can still reside even though those bacteria, those normal flora, are there. So the normal flora of the digestive system is very essential to not only our health but also in preventing diseases. And what these organisms do is they actually limit the available surfaces for the pathogenic organisms to actually colonize. They compete for nutrients, they excrete various antimicrobial properties. They can assist with digesting by breaking down that food. And they also can provide nutrients to the body. For example, E. coli actually produces vitamin K. And so vitamin K is actually needed with our clotting abilities and our ability to adequately clot. It impacts metabolism and obesity. It affects the development of depression and diseases, so things like diabetes. They kind of help with maintaining that balance for diabetics. And they also kind of help with the various immune responses. So gastrointestinal infections of the digestive system can result in things like dysentery, gastroenteritis, and other various GI symptoms. A huge variety of pathogens can invade the digestive tract, but the symptoms are usually very similar. So with our milder signs and symptoms of infection will include things like abdominal pain, diarrhea, fever, vomiting. And some of our more severe symptoms of a GI infection will include things like enteritis, gastritis, gastroenteritis, dysentery, dehydration, or actual hypovolemic shock, which can cause organ failure. So most of our intestinal pathogens that cause diarrhea and dysentery are transmitted through a fecal oral type route. And so with fecal oral route, this is usually due to contaminated food or water. And most of us experience some sort of infection like this due to some sort of contamination of our food or water. And so hand washing, sewer management, water sanitation, proper food handling and preparation is very essential to help limit these types of infections. Diagnosis can be made typically by performing some sort of testing on the actual fecal sample. So this could be done by an actual culture, but there are also molecular type methods, as well as microscopic examination looking for parasites is going to be how we're going to kind of help diagnose these. And then you can also have some other non-laboratory tests which can aid in diagnosis of some of these infections, which can include things like endoscopies, looking for any sort of damage. So we've got several organisms that we're going to kind of look at and talk about within our viral type infections. So you have infections of the salivary glands. This is the mumps. Then you can have acute viral gastroenteritis, and this is when the immune system tends to mount some sort of rapid, effective response to a GI tract viral infection. And so they're usually acute infections, so they have a sudden onset of symptoms, and then they kind of resolve quickly within a few days. So these would be things like rotavirus and norovirus, so your more commonly known stomach bugs, so to speak. Viral hepatitis actually infects the liver, and so most of these you've already heard of with hepatitis A, B, C, and then some of your less prevalent would be Hep D and Hep E. So mumps is the infection of the salivary glands, and it's due to exposure to respiratory droplets or through direct contact of this infected saliva. And of course, it's going to cause those salivary glands to kind of swell in the jaw and neck area. And if it's left untreated, it can lead to things like meningitis. And so this infection, vaccines have helped with reducing these types of infections, but if there is a suspicion, then there are some PCR type testing that can be done, or actually looking for antibodies to the mumps within the actual blood sample. And so typically with this, you're just looking to kind of treat the symptoms with this infection. Rotaviral gastroenteritis is due to the rotavirus. Of course, it is a fecal-oral transmission. And so typically you're going to see this within children, where they're going to get that watery diarrhea that lasts for several days. And basically with this, like most viral infections, you're just treating the symptoms. You're kind of supporting the symptom management area of the patient to prevent things like dehydration with an infection like this. Norovirus, we can see a lot of outbreaks with this particular virus, a viral type infection. And so usually you can see these kinds of outbreaks in like your nursing homes or long-term care facilities. And so again, it is transmitted fecal-oral. And to prevent it, basically keeping surfaces clean, hand washing, and with treatment, of course, again, you're kind of monitoring symptoms and making sure those patients stay hydrated. Hepatitis A, B, and C, of course, these are all caused by different families of viruses. But with these viruses, of course, they all are very similar in signs and symptoms, which would include fever, loss of appetite, joint pain, fatigue, abdominal pain, nausea, clay-colored stools from where the liver is not actually producing that pigment that will actually change the color of the feces to the typical brownish type color. And the patient will also develop jaundice, so where that bilirubin typically will be excreted within the feces, now you're going to start seeing it spill over to things like the urine or the actual skin color are within the eyes. So a lot of times you will notice that yellowing color for a hep patient or any patient that's got some sort of liver issue going on. You will start seeing the whites of the eyes start to turn yellow. So that's very indicative of some sort of liver issue. And so testing for these organisms would include looking for those antibodies to those actual viruses through an automated type testing, looking for those actual antibodies. Hep D and E, with these organisms, they are rare in the U.S., but they are concerned in developing countries. And so with a Hep D infection, you cannot have this infection unless you've got a Hep B infection. So typically the transmission for these infections are with a co-infection, so the Hep D and the Hep V at the same time. And so again, signs and symptoms of viral hepatitis are pretty much all the same, and you're looking for that presence of jaundice or that increase in bilirubin, as well as you're going to have some of those liver enzymes, your AST, your ALT, to be abnormal as well. And again, for diagnosis, you're looking for those antibodies to be detected in the patient's blood sample. Bacterial infections would include dental infections like periodontal disease. And so this will more prevalent in adults, and it starts as gingivitis, and then it kind of progresses from there. Dental caries are your cavities, so to speak. These are more prevalent in children. Of course, adults can have them as well. Then you have your fecal oil infections with your gastritis or stomach ulcers being caused by H. pylori, various food poisoning, and other foodborne infections that we're going to discuss. With your periodontal disease, you have that growth of the anaerobic bacteria that causes the biofilm along the gum line. And then with your cavities, you have a variety of organisms, but mostly your Streptococcus mutans that's going to cause those actual cavities. And so with these, you're looking for various symptoms. So with periodontal disease, you're looking for the swelling, bright red bleeding gums, any sort of like loose teeth, receding gum lines. And of course, with the cavities, you're looking for the discoloration, tooth sensitivity, pain as that cavity kind of develops deeper into the tooth. And of course with these you've got that plaque biofilm that will kind of form and hold that bacteria against the tooth enamel, and then from there it just kind of goes from there, where it actually will, once that biofilm is formed, that organism will kind of start invading and multiplying. So H. pylori is a gram-negative microaerophilic curved rod. And so with this organism, it can infect actually about 2/3 of the population. And so within your developing nations, you can see it a little bit more. So people can actually have this infection for years and not really even realize it. And so it is a fecal oil transmitted type of infection. And so while most patients are asymptomatic, you can start to develop ulcers over time, which can cause you to become nauseated, have vomiting, abdominal pain. And if it reaches the point where it actually starts to bleed, then you can start seeing the presence of blood and stools, as well as it can start causing problems in the patient with like that bleeding ulcer to cause additional complications as well as other infections. And so what we look for when we're trying to determine if a patient has this particular type of infection is you're looking for the antigens in the stool, or you can also look for the antibodies to that particular bacteria in the blood sample. And then there are also the urea breath tests where that bacteria actually produces the urea. And if they suspect this organism during an endoscopy, they can actually do a small biopsy and check for the presence of that organism. And if the organism is there, then they can actually treat it with antibiotics to help kill that organism. So we do see a lot of foodborne illnesses due to bacteria, as well as you can see them with viral type infections, but the foodborne bacterial infections do cause a big portion of the foodborne illnesses. The majority of foodborne illnesses are due to the fecal contamination of food or water sources. So with our foodborne infection, you can actually be infected with the actual organism, and you can also have symptoms due to the toxins that are produced from that organism. So another example for this would be the aflatoxin that is caused by the aspergillus toxin that is produced from aspergillus. And so with foodborne infections, this usually happens after ingestion, and the pathogen establishes infection within the host. And then with symptoms onset being 1 to 5 days after exposure, and causing things like fever, headache, muscle aches, nausea, diarrhea, abdominal pain, and recovery can take a few days to weeks. So with actual food poison, this is not infection, but this is the actual toxin that has been ingested and actually causes the illness. And so this can happen 30 minutes to 6 hours after exposure, so it is pretty rapid. And of course it includes nausea, vomiting, occasionally diarrhea and abdominal pain, and it usually only lasts for about 24 hours, but it can be several days depending on how severe the case is. Campylobacter is gram-negative bacteria that causes the foodborne illness. So it is a spiral-shaped microaerophilic bacteria. And so it is the most common cause of diarrheal illness in the U.S. And chickens will naturally harbor this organism. So you can get some cross-contamination with raw chicken. So making sure that you properly handle poultry products and keeping surfaces clean will help to prevent these infections. One of the complications from this infection that is known is the Guillain-Barré syndrome, which you have the autoimmune disorder that causes the muscle weakness and paralysis. So it can actually cause complete paralysis of the patient, needing to put them on some sort of life support. So stool cultures can be used to identify this organism, but most commonly you're going to use some sort of PCR testing to check for this particular organism. Shigella stoni is the cause of shigellosis, and so we can see this within toddlers, but also international travelers who consume feces contaminated food and water. It is highly contagious because it can be transmitted fecal oil, so making sure to keep your hands washed is a good way to prevent this. If traveling to areas where there's not very good sanitation, especially of the water supply, you want to make sure that you are using boiled water or bottled type water, anything that's kind of already been sterilized, and making sure that you wash your fruits from these countries, or while you're in these countries, before you actually eat them or peel them. And so it can actually cause bloody diarrhea, abdominal cramping, fever, And it can also lead to hemolytic uremic syndrome, which is caused by that sugar toxin. So again, to identify this, you would be identifying somewhat based on symptoms with that watery, bloody diarrhea, abdominal pain, and then you would also be performing a culture where you're looking to recover that organism. And because of the hemolytic uremia syndrome, it can actually cause a very small percentage of mortality. So you definitely want to make sure that an infection like this does not go on too long. So there are various E. coli strands that can cause gastroenteritis. And of course, E. coli is a gram-negative motile rod, and it is common normal microbiota within mammals, so within the intestinal tract. While most strands are non-pathogenic, you do have some strands that produce the sugar toxin. Your pathogenic strands are characterized based on their virulence factors, and so you have these are actually grouped into pathotypes or pathovars, and so you're looking at the O and H antigens. So you have 6 pathotypes of E. coli that are transmitted fecal oral, and then with these pathotypes, they can vary with symptoms, disease severity, the length of infection, and how you treat them. So with enterohemorrhagic E. coli, or EHIC, E. coli 0157H7, so you'll hear it kind of termed a couple of different ways, but this is the one that produces the sugar toxin. And so you can have outbreaks with contaminated meat, unpasteurized dairy or juice products, produce that's not been washed, produce that has been washed or has been watered with water that is contaminated by this particular organism. And so it can actually take 1 to 10 days for this organism to incubate and actually start to cause issues with that toxin production. And so that toxin will actually kill the host cells by inhibiting protein synthesis, and it's able to resist stomach acid, which makes it more pathogenic or able to survive to actually start causing problems. And it can cause the hemolytic uremic syndrome, especially in children or immunocompromised and elderly patients. And so when we're doing testing for this, you're going to be performing a stool culture or molecular methods where you're actually looking for the O and H antigens to determine which pathotype we're actually dealing with. Non-typhoid salmonellosis. And so with this particular organism, it's usually going to arise in an infection due to consumption of undercooked meat or raw eggs, handling reptiles, especially turtles. It can also live within chickens. So with this organism, it typically does peak in the summer and fall with an incubation period of 6 hours to 3 days. So making sure that you thoroughly cook meat or proper handling of your meats when you're actually cooking, especially poultry, making sure you wash your hands, sanitizing surfaces. And so with this disease, the bacteria are actually able to survive the aciduria of the stomach, which can cause the pathogenesis for those organisms to actually multiply inside of cells. And we are, again, with culturing this organism, you can do culture as well as molecular methods to look for those O and H toxins. Typhoid fever, again, is caused by the salmonella, the serotype for typhi. And this is rare, very rare in the US, but you could still see some cases just from people that have traveled to other countries. Of course, it's transmitted human to human or through contaminated sewage, or contaminated water or food by sewage sources. And these patients can actually recover. About 5% of these patients can actually recover and be asymptomatic carriers, where they actually shed the bacteria into their feces or contaminated food sources by handling food sources. And so this is where, if you recall the story of Typhoid Mary, where she actually made people sick because she was a carrier. Cholera, caused by Vibrio cholera, which is a gram-negative bacteria. Again, rare here. It's usually going to be found more in underdeveloped countries. Transmission of fecal-oral, or through contaminated food and water sources. And it can cause a very profuse watery diarrhea. So that's very characteristic of this particular type of infection. And it's because that cholera toxin will actually trigger the intestinal epithelial cells to release water and ions into the intestines, which will create a lot more of that watery diarrhea. So making sure that you treat this infection and provide supportive care with IV fluids is very critical for these patients to prevent any sort of dehydration. Clostridium difficile, or C. diff, which is the cause to pseudocolitis. And so you see this a lot in elderly patients through a hospital-acquired type infection who've had recent antibiotic therapy, but you can also see it outside of the hospital as an opportunistic type pathogen after someone's been treated with antibiotics. Has a fecal-oral transmission, and patient can develop diarrhea, fever, abdominal pain, nausea. And some of these patients, especially if it's community acquired, they can go several months without being diagnosed, just because, they weren't in the hospital, or maybe they didn't feel like they were recently taking antibiotics or something. For some reason, they're just unsure of what's going on. Some patients may think that maybe they're developing some sort of food intolerance. And so they can go several months with episodes of diarrhea and abdominal pain before they're finally diagnosed. And so with this bacteria, it is a spore-forming bacteria, so it can resist a lot of things, and then it produces some toxins that actually causes damage to the colon and induces inflammation. So making sure that this particular organism is diagnosed is very key in treating these patients. And again, I like to note that C. diff has a very unique smell in the feces. So once you've been exposed to it and you kind of get an idea of what that smell is, you usually can kind of tell pretty quick, especially for you nursing students. Once you start treating some of these patients, if you're having to help with changing patients or anything like that, collecting the stool sample, you'll get an idea pretty quick of what a C. diff stool sample smells like. Parasitic infections will include the protozoans and the roundworms and flatworms. So we've got several of those that we will take a look at. Giardia is a very cute little organism, actually. So it's got, when you look at it under a microscope, it's got that appearance like it's looking back at you. But this organism is a transmitted fecal oral, and you get the parasite exposure to the parasite through ingesting some of those cysts. So a good way to kind of prevent any kind of exposure to it would be to boil water or to filter water to try to remove these organisms. It can cause things like diarrhea, gas, abdominal cramps, nausea, vomiting. And if it's a chronic infection and goes on for a long time left untreated, then it can actually cause malabsorption of nutrients. And so these cysts actually do resist chlorine. So just treating with chlorine alone is not very effective. So because these cysts can survive outside the body for a lengthy period of time, then filtration systems are a good way to kind of help eliminate this organism, or by doing a water boil. And so you can detect these organisms through molecular testing as well as its appearance under the microscope. Amebiosis, or Entamoeba histolytica, it's usually found in your more tropical areas that have poor sanitation, but it is transmitted fecal oral through some sort of contaminated source. Again, filtration systems or boiling water helps to remove these organisms. And it does cause a type of dysentery or profuse diarrhea with mucus and blood. So that is kind of characteristic of this one, to actually cause the blood due to the enzymes of this organism killing the epithelial cells and causing some of those ulcers to form, which will then in turn bleed. So this organism can actually progress to the bloodstream and cause things like abscesses in the liver, lungs, and very rarely can actually reach the point of moving to the brain. So again, you can diagnose this looking at it under the microscope, looking at the specimen under the microscope and looking for the cysts or the trapezoites to be the cause of this infection. Cryptosporidium can be transmitted to the patient through drinking or swimming in untreated water. It's very commonly seen in daycare settings with seasonal outbreaks, mostly in the summer. Transmitted fecal oral, and making sure again to use those water filtration or boiling water to kill this organism that causes diarrhea, nausea, vomiting, fever, cramps. And again, you're looking for the presence of those oocysts in your stool specimen, or you're looking for the antigens to that actual organism. So now we're moving on into the tapeworms. You have the Haemophilus nana, which is the dwarf tapeworm, and again, fecal oral transmission. And you're looking for the actual presence of those eggs in the stool. So this would be an O&P culture that where you would send to the lab for the lab to actually look for these organisms. If the eggs do start to hatch inside of the patient, then you can start leading, this will start leading to an actual heavy population of those worms, which can in turn lead to other complications. Taenia organisms cause tapeworms, and again, fecal oral transmission. You can get contamination through cattle and swine. These eggs will actually start to hatch. The eggs are swallowed, hatched in the intestines, and then the hatched larvae can actually migrate to the muscle of the animal, and then the person would actually ingest that parasite. So making sure the properly cooked meats is a good way to prevent transmission of this organism. And so again, this organism would be detected on an ovarian and parasite test where the lab tech would actually look for the presence of the organism in the stool sample. Next is our fish tapeworm, which can be acquired through consumption of raw fish, predominantly, and it can cause a gastroenteritis type symptoms. Some cases can actually progress to the point of causing pernicious anemia. And so humans will actually consume the infected fish, which will at the end start to mature and attach to the intestinal wall, and then mature to an adult and actually start releasing eggs, and it'll just continue to grow within that patient. And so for diagnosis, again, you're looking for the eggs or part of the actual tapeworm itself. Next, we have our pinworm and hookworm. And of course, with our pinworm, you do see this more in your school settings, or sometimes they'll refer to it as an itchy butt syndrome. So with children, this worm will actually come out and lay its eggs in the anal opening, and then typically at night. And so those eggs around the anal opening, or that worm working its way down, will actually cause itching of the anal area. So you'll see a lot of little hands back there in that area, which then their hands become contaminated, and you know how little kids like to do with their hands, and they're always in their mouth and always on everybody else. So it just turns from one thing to the other, and then you have an outbreak. So you can actually detect this organism by doing a sticky paddle test, or taking some Scotch tape and just kind of sticking it in the perianal type area, or the perianal area, and then looking at it in the microscope, and you're looking for that contact lens appearance of those eggs on that specimen. And then with your hookworm, you know, of course, these worms have those hooks on them, and so that's kind of how we identify them, looking at them under the microscope. But you're also looking for the eggs for, if you're doing an O&P, an examination, you're looking for the eggs of this organism. And sometimes this organism can actually cross over the intestinal barrier, and it can move on over to where it actually will enter the bloodstream, and then it'll go into the lungs. And so you can actually have patients that will actually cough up a worm from this organism. And so you can actually, sometimes the patients will actually expel it in their feces, and they may see the worm in their feces as well. With Ascaris, again, fecal oil, ingestion of the egg directly from soil, or any other sort of contaminated source. It's usually asymptomatic. It can be a mild infection. And this is one of those organisms that I actually had the experience of diagnosing or finding this egg on a child in a urine specimen. And the child was probably like 4, 5, 6 years old, and the child had some sort of mental disability. And so when they brought the child in through the ER, and I found this particular egg in the urine, which is not a common finding, but because of how they had to do the collection on this child with one of those little pediatric bags taped to collect the urine, it actually got a little bit of fecal contamination. And long story short, they had issues with this child actually eating sand out of the sandbox, and so that's where they believe that this particular infection came from. But typically you're looking for the eggs and the feces to diagnose this particular infection. Trichinella, ingestion of meats that actually contain that cyst. So you can find it in wild game as well as pork. So you want to make sure again that you're cooking your meats thoroughly to make sure that you are not getting eating this actual cyst. So it can cause nausea, diarrhea, vomiting, and it can also kind of progress to things like muscle pain, fever, chills, headache. So the cyst can actually is actually resistant to the stomach acid, and so it can kind of persist for a longer time, which allows it to kind of penetrate and cause it to migrate into the muscles. And so diagnosis could be looking for the antibodies to this organism, or actually performing a muscle biopsy and looking for the cyst of the organism. Schistosomas, of course, there are 3 different schistosomas. Depending on the schistosoma will depend on where the actual infection is. And so you can have a variety of types of infections with these particular organisms. And you can have a couple of different phases of the infection. But these are your flukes. And so you can get contaminated with these organisms through fresh water. And so you want to avoid, sources that could have these organisms in it. So poor sanitation type areas. So you definitely don't want to be swimming into a pond that gets contaminated by sewage in any source. And so with these organisms, again, you're looking for the egg to be detected microscopically, as well as there are some molecular methods that can also look for the antigen or the parasitic antigen or the actual parasite. You're looking for the presence of the parasite due to its DNA or its antigenic proteins, as well as you can do some blood tests looking for the antibodies, the body's response to these organisms.